Why is pre-XDR TB treatment so long? Imagine fighting a battle where the enemy keeps changing its tactics, making it harder to win. That's what treating pre-extensively drug-resistant tuberculosis is like. This form of tuberculosis is resistant to many of the main drugs used to fight it, which makes treatment more complicated and longer. When bacteria become resistant to drugs, standard treatments no longer work effectively. Doctors have to use a combination of second-line drugs that are less potent, often with more side effects, and these drugs take longer to kill all the bacteria. Pre-XDR TB is defined by resistance to rifampicin, a key first-line drug, plus resistance to either fluoroquinolones or second-line injectable drugs. This resistance limits the options for effective medicines, so doctors often turn to newer drugs like bedaquiline, linezolid, or clofazimine. These drugs may take longer to work because they have slower bactericidal activity, meaning they kill bacteria more gradually. To prevent the bacteria from developing further resistance, treatment must be carefully planned and extended, often lasting 6 to 9 months or more, compared to the 4 to 6 months needed for drug-susceptible TB. The severity of the disease also plays a role. Patients with more extensive or advanced infections tend to respond more slowly to treatment, requiring even longer courses to fully clear the bacteria. This is especially true if the infection has spread to multiple parts of the lungs or other areas. Longer treatment helps ensure that all bacteria, including those hiding in dormant or hard-to-reach places, are eliminated. This reduces the chance of relapse, which is when the disease comes back after treatment ends, and prevents the bacteria from developing even more resistance. Another important factor is safety. The drugs used in resistant TB treatment can cause significant side effects, so doctors need to monitor patients closely. If adverse reactions occur, treatment might need to be extended or adjusted to ensure the patient stays safe and adheres to the regimen. Because of these complexities, treatment plans are often personalized, and the duration can vary based on how well the patient responds. Recently, there have been promising developments with shorter, all-oral regimens lasting 6 to 9 months. These newer treatments have shown good results in some patients with pre-XDR TB, offering hope for shorter, easier courses. However, they are not suitable for everyone, especially those with extensive disease or complicated cases. The World Health Organization and experts still recommend longer treatment durations in many situations to make sure the bacteria are fully eradicated and to prevent relapse or further resistance. In essence, the reason pre-XDR TB treatment takes so long is because of the bacteria's resistance to many drugs, the need to use multiple medications carefully, and the importance of preventing the disease from coming back or becoming even more resistant. It's a careful balancing act that requires patience, close monitoring, and a tailored approach to each patient. Always remember, anyone undergoing treatment should work closely with healthcare professionals to ensure the best possible outcome.